welcome. Thank you for tuning in to Conversations with Dr. Yella, episode 2. Let's talk about cancer. So today is February 1st, 2022, the first day of Black History Month. And I want to focus on diseases that primarily affects our Black communities. So according to the CDC, the top 5 diseases that affect Black women in particular is number 1 being heart disease at 23%, number 2 cancer at 22%, 3 is stroke at 6%, 4 is diabetes, and 5 is Alzheimer's disease at 4%, and diabetes was at 5%. So since cancer is a hot topic, let's talk about cancer, particularly cervical cancer and breast cancer. And these can occur in both women and men. But I wanted to focus mainly on women, and I would do a later episode for the men and cancers that are more prevalent in men, our Black men in particular. So let's start by defining cancer with this most basic definition. Cancer is a disease in which the body's cells grow uncontrollably, and it can potentially spread to other parts of the body. Since there are different types of cells throughout the body, there are several different types of cancers. So the types of cancers can even vary within one particular subtype of cell. And this is the case in breast cancer. For instance, there are 5 major subtypes of breast cancer, and they are termed basal-like, luminal A, luminal B, HER2 positive ER negative, and normal breast-like. Here you can see how breast cancer occurs. So in a normal cell, you have your basement membrane, which is the outermost part of that circle, and then the basal cells, which is right on top of that, followed by the epithelial cells. And inside of the circle, which is the innermost part, is referred to as the lumen. And when you hear me say luminal A, those cancers are the ones inside of the circle in the innermost part, and luminal B as well. The breast cancer that is more basal-like are the ones that occurs in the outermost circle of their normal cell. So you can see how cancer can progress, and the next part would be cancer inside the duct. And then after that, you have invasive carcinoma, and that's the cancer spreading. It's leaving the luminal and it's entering the epithelial cells that can then start leaving the basement membrane. Finally, you have metastasized cancer, which can spread to other parts of the body and cause other types of cancer, such as lung cancer, because it's in close proximity to the breast. As you can see, the cancers that are considered basal-like, these are the most aggressive, and you can see from this image, because those cancers are closer to the basement membrane, it's closer to spreading out of the cell and metastasizing more quickly than those that would start in the lumen. So those cancers that are in the lumen have the best prognosis, which would be more treatable cancers, and those that are basal-like have the worst prognosis. Breast cancer is the leading cause of cancer-related death in women worldwide, despite significant advances in diagnosing and treating breast cancer. Why is this the case? According to a review on breast cancer by Polyak K, there are 5 major reasons that breast cancer is the leading cause of cancer-related death in women. And the first one is prevention. So who needs to be prevented? There are early screenings for those who may have cancer that run in their families, or for those who may have gene mutations, as in the breast cancer gene known as the BRCA gene. Everyone has BRCA genes, and it's normal in people, but for those who have a particular mutation in that gene, they can have a higher risk of developing breast cancer. So there are screenings for this, and that can help prevent getting cancer, breast cancer. And also the mammograms. So if women regularly get their mammograms, they can also prevent the development of breast cancer by catching it early on. The second one is diagnosis, and this is important because we need more specific tools to diagnose. As with the prevention, you could do those screenings that will help in diagnosis, the mammograms that also will help in diagnosis. And if we were to define or find different markers in addition to the BRCA gene, like there are other genes that are known that are potential risk factors for getting breast cancer, and maybe we could find even more that can catch this disease early on. And maybe this is something our gynecologists can incorporate in our annual visits whenever we go get our annual pap smears. So the third one is the tumor progression and reoccurrence. So what causes this and how do you predict it? So now I want to explain this briefly by this image here. So for tumor progression and reoccurrence, we can look at this image here. So you have a primary tumor that's present, and a patient undergoes chemotherapy to reduce that tumor. But there are residual cancerous cells that are left. These cancerous cells can expand and the cancer can relapse. And then it can also metastasize and go into the lung and other parts of the body. And the fourth one is treatment. So who should be treated and how? This is particularly hard because, like I mentioned, there are 5 different types of breast cancer. And according to the Breast Cancer Research Foundation, Black women are disproportionately affected by the more aggressive subtypes of breast cancer, such as triple negative breast cancer and the inflammatory breast cancer. And these are likely to be more diagnosed in younger ages for our Black people. And I just quickly want to define what they mean by triple negative breast cancer. So there are 3 receptors that are absent on these cancerous cells. And remember from my previous episode, I told you what a receptor was, a protein that sits on top of a cell that acts as a gateway. So in particular, these 3 receptors that are absent is the estrogen receptor, progesterone receptor, and the human epidermal growth factor receptor. So 2 of those you may think is very familiar, estrogen and progesterone. Yeah, these are hormones that are at very high levels in a woman's body. So if your body cannot detect these hormones and do not have a gateway for these hormones to get into to help homeostasis with hormones, then yeah, of course, that could be a really bad problem. And those cells, they are dysfunctional. A cell should be able to do that. So this makes it very hard for scientists and doctors to treat this disease because most of the treatments, they target the receptors. And if you don't have one, those treatments will not work for you, that drug will not work for you. And so that is part of the reason why early diagnosis of breast cancer for this particular type could be very useful and life-saving, really, for those who develop triple negative breast cancer. Okay, and finally, the 5th one is therapeutic resistance. So that's exactly what I was just mentioning. What happens if you do not respond to the treatment? So if the therapies are out there and the treatments are, why aren't they working for Black women? And like I mentioned, the TB and C is more common in Black women, and I told you why that is not working. Another thing that we have to consider, though, is other factors. So one other reason is that the Black community suffer from inadequate health insurance, and we have limited access to healthcare facilities, and that could affect the screening. It can affect the follow-up care, as well as the completion of their therapy. And reoccurrence of cancer can happen, and resistance to drugs can ultimately happen as well. One other thing, would you believe me if I told you that these therapies do not work on Black women because of our way of thinking and our way of life? Could our life choices make all the difference? So I say this because Black women are statistically more likely to have diabetes, obesity, and heart disease. And that we are also less likely to breastfeed after childbirth. 3 of these things are considered life choices, as in obesity can be managed by diet, proper dieting, exercises, and other thing, as well as eating right, diabetes can be managed as well. The other thing is breastfeeding our babies. There's 3 things you could do right there that can decrease your risk of developing breast cancer. Another reason why these treatments may not work is because they were developed in response to how white women respond to treatments. And this is because mostly white women participate in clinical trials. Black women's participation in clinical trials can make all the difference, but we don't want to be guinea pigs. So this is understandable considering the complex history and the unfair experimentations that were done on our Black folks in the past. So we need to find a way to make our people feel more comfortable with the science, which is why I am here giving you the science behind the disease. So I'm hoping that this will have at least a small impact on our community. Because let's face it, if we don't do something now, we may never have treatments that really work for us. Now I like to jump into cervical cancer. So cervical cancer is caused by a virus known as human papillomavirus, or HPV. So how can a virus cause cancer? Okay, the HPV, once it inserts a cell, it can cause DNA damage to that cell. And a damaged cell can lead to a dysfunctional cell. And what are dysfunctional cells? Cancerous ones. So this type of cancer is almost 100% preventable. Maybe not 100%, but it's mostly preventable these days. And that's primarily due to the vaccine. And this is given between the ages of 11 to 26, and both boys and girls can take this vaccine. And you can refer to my previous episode to understand viruses and how vaccines work in this episode. But briefly, I'll recap really quickly. A virus is a living thing that survives and thrives within a living cell. And they can enter the cell through a receptor, which is the gateway into a cell. And once it enters, it can make copies of itself, and that infected cell, in this case, makes copies as well. And so this is creating multiple cells with this HPV in it, so multiple damaged cells, and that's how HPV can lead to cancer, cervical cancer. Quickly, you can see here the natural history of HPV infection. So in the cervix, as you can see on the left, is a normal cervix. And whenever a person has sexual intercourse and the HPV is transmitted, it can infect the cancer cell, well, infect the normal cell, and that would make it then precancerous. And those HPV infected cells can divide, make copies of itself, and then next thing you know, you have invasive cervical cancer. So the HPV vaccine, it helps the body produce antibodies that can neutralize the virus before it has a chance to infect the cervical cell. So how do you get HPV? It is a sexually transmitted disease, and this there are different types, over 100 different types of HPV, some of which our body naturally gets rid of, and others we don't have a mechanism of getting rid of it, and that's why the vaccine makes up for that. And we are having problems, however, with getting people to take this HPV vaccine. As you can see from this image here, according to Johns Hopkins Medicine, you can see these are the top reasons why parents aren't giving their children the HPV vaccine. They're concerned about the safety of it, the lack of necessity because they think it's not needed, the lack of knowledge, and the absence of the physician recommendation, and finally, it's assuming that their kids aren't sexually active. And also gender necessity, they don't think that their boys will likely get cervical cancer because it's more highly prevalent in women. And boys don't have a cervix, of course. So I thought this was very interesting, so I just thought I'd share it with you guys so you could see the problems that we face. And as you know, HPV is 100% preventable with the vaccine. So that's something to consider when you are talking to your pediatrician about this. From the looks of it, looking at these numbers, it seems like the COVID vaccine is not the only vaccine that people are afraid of. As with the COVID vaccine, the HPV vaccine helps the body produce antibodies that can neutralize the virus before it has a chance to infect the cell. The antibodies are generated to an antigen, which is a foreign molecule, and it's unique to the virus. The vaccine contains a modified version of that foreign molecule, and our immune cells take that foreign antigen up and it generates an antibody response to it. So because most of the diseases involve the immune system, it's important to know how the immune system works. And that is what I would like to get into next, but not today. So I am hoping to tell you all about the immune system in the next episode of Conversations with Dr. Yella. And I am happy to answer any questions. Please write me on Instagram, on Facebook, leave a comment on the YouTube channel, or just DM me, and I will be happy to answer any questions that you may have. And that is it. Thank you for tuning in to Conversations with Dr. Yella to know the science behind the disease. Bye.